A drug epidemic is sweeping Africa. Illicit drug consumption and smuggling is a global menace, but it is affecting some regions more than others. This menace is spreading faster with the advent of social media. WION correspondent Louisa Olaniyi has this report.
Drug menace is rampant across the globe, and Africa is not left out. There are reports of regular raids and arrests of people dealing in it. Experts say unconventional drug use and addiction are not new phenomena, but it has only been made more popular through the advent of social media. The economic downturn witnessed across the continent has further pushed young people into drugs.
As the economic situation worsens, you find that people naturally seek for a means of escape. It's a normal phenomenon. Happened in the 60s, in the 70s, and even in this decade. Once globally there's an economic downturn or high rate of unemployment, or generally social issues that leave people in a state of uncertainty, or in a state of apprehension, or in a state of hopelessness, you find that people naturally seek for a means of escape as a way to cope with their predicaments.
The reported use of human bones as a part of hallucinogens is leading to people raiding graveyards in Sierra Leone. Here, the human bones are grounded for their high density of sulfur and mixed with fentanyl, tramadol, and formalin. It imitates the effect of xylazine, which is called a zombie drug. It is described as the worst epidemic in Africa as it has spread to Liberia and Guinea. Also in Borno State, Nigeria, youths that can't afford hard drugs now store urine for days to ferment and drink it. Experts have highlighted preventive measures and alternate coping skills for young people while tasking the government with more funding for research, training, and support for institutions that cater to addressing the menace of drug use.
So as a country, we need to prioritize the sector. We need to give funding for research, training, empowering individuals in the sector so that they don't leave the country and go to other countries. And then we need to put in policies. When we draft in policies, such as we have the Mental Health Act and so many other policies or guidelines recommended by the WHO, we need them to be enforced.
The United Nations Office on Drugs and Crime Household Survey, conducted in 2018 but reviewed in 2021 and 2022, placed the level of substance abuse in Nigeria at 14.3%, which was 3 times higher than the 5.6% global average. Now, the report says Africa remains a key transit region for cocaine in the west, heroin in the east, and cannabis resin in the north. Various media reports say the National Drug Law Enforcement Agency seized over 6,000 tons of illicit drugs from January 2021 to September 2023. The Drug Enforcement Agency also arrested over 36,000 drug traffickers during the same period.
The search for alternative means by young persons in Nigeria and other parts of Africa to alter their state of consciousness has led many to exploring a range of illicit substances, activities, and practices that are detrimental to health. Psychologists believe these behaviors are often rooted in complex socio-economic factors, mental health issues, and a desire for escape. From Lagos, Nigeria, Louisa Olaniyi, WION, World is One.